outside, like here, but I recommend them. We're not going to cover it. Full implant again, and some reason implant side is not properly placed in. So I'm a dental laboratory technician. How can I save this one? They don't have to make another implant placement. Whenever they place implant, it's not easy. It is a lot of time and it's money and effort. Then we have to do a whole thing over again. It's a lot of thing to do. So luckily, I do have a ability to make the fine prosthetic, even though I do have a 3 implant, 4 implant, 5 implant, 6 implant, zigzagging implant, and place implant is sticking out facially. So I saved a lot of those implants, which is so glad. We utilize a lot of CAD/CAM, CNC milling, and then our brain especially, that was more important. Today, I would like to share with the 4 implant, which is a huge pony here, both sides. And unfortunately, maxillary, so all the time I say that depends on patient upper, high, up, high, depends on that. So my implant, pink side, I have to cover it, okay? On that one, I cannot do much about it because whenever they're talking, they see the between my restoration compared to tissue as a line down there, which is patients hate it. And a lot of people notify, you have a fake teeth, which is nobody like that. So I have to cover with the tissue all the way up high, even though people has a little bit above a smile. So this is what I fabricated finally with a pink tissue, okay? And then we extend it here quite a bit, okay? And also this one is to make a little bit more bulkiness whenever patients wear it, and then I can make this more fatter, okay? So make them form contour, and then make right side, left side, cover it, and as much as possible. Technically, we made the anterior single restoration, but this one we tested either single restoration and then over 3-unit bridge in between side by side. So even central 6-unit teeth here, okay, and this one is the 6-unit restoration top of that. Okay, so we fabricated. So here's the differences between the sometimes patient have a heavy occlusion contact. So I noticed that individual crowns is much better to repair it, but whenever they push occlusions really hard, sometimes I noticed that even though it's very small abutment, and then we fail it. Not fail, just like de-cement, so they have to re-cement back. So that's why this one I made it 3-unit for 3-unit is better. But what if they grinding, cracking, they can grind the prep, and then we can make sealed another crown, for it's not a big problem. So we finished the restorations between this. Try the 3-unit, and then total about 4-piece restorations. Top of that, we're matching it. Okay, and especially patient has the natural teeth, the very heavy forces. Now another one is we have to see the lingual side, which this patient said that they want the more thin as possible. So we make the really thin, which is metal. We're going to polish it. So that one is trying to narrow down for them. So here is the pony, and this is what I'm talking about. Okay, so patient wanna thin as possible here, but think about it. I have to make out as possible here. Okay, so this much has a huge gap underneath. We have to do it. Okay, so that's why we finished this one. Anyway, If they place implant correctly here, they'll be perfect. Place it here, they'll be awesome. But regardless, we have a top situation to create it, the final restorations to top of that, and then we sealed it, which is monolithic outside, like here. But I recommend them. We're not going to cover it. Okay. So if I cover it, so huge issue, which is a foot trap. Okay. So that once we finish that line, finish that line as well. So that's the final result. Okay. This is what I'm talking about, the 3 unit. Okay, so 6 unit. Make more bulk out, which is patient requested. And then here is another 3 unit. It's monolithic zirconia. We're going to cement it. We're going to polish it. And then another is great case, just finish it. From here, huge gap. We're trying to avoid it, but not much I can do. And we make this great surface texture and the tissue contour, everything. And this is what look like underneath. So this is chrome cover. This is final. Okay, I'm going to show them after cement is what look like. That's the final will be, and then we make the another snide guard as well, and also make sure the occlusion contact is right. And before we send it out, it's screw down all the way. That's behind the story, and then we provide the dentist as much as possible. So now after cement, this will look like this. Okay, exactly patients wants more detail, but here is more specified or no longer. And then make thinner as much as possible here. So like I said, polish it and cement as well. Okay, this is the final site and 7 staircase.